So let's come on the next topic, that is mechanism of cell injury. So here is a list of the university exam questions which are usually asked from this topic. So I request you to look at the university exam questions either in the notes or it is provided in the PYQ sections also. So you just open it there and have a look, and whatever I am discussing, all the questions, the long, short and very short will be covered there. So coming on the mechanisms of cell injury, basically there are 4 mechanisms of cell injury. I told you whenever all the cells in human body are in homeostasis. So whenever the stress is acting, 3 things happen one by one. The first thing is the cell adaptation. We have already covered that. Now the reversible and irreversible cell injury. So what are the mechanisms of reversible and irreversible cell injury? There are 4 mechanisms of these injury. The mechanisms of reversible and irreversible cell injury. So the first mechanism is ATP depletion. The second is mitochondrial damage. The third is loss of calcium homeostasis, and finally free radical injury. Most of the PYQs which are asked in university exam are on free radical. Free radical is very important. You get many questions on that. So I will be discussing all 4 one by one. The first one is the ATP depletion. So have a look in the diagram. Can you see this is a cell? This is a normal cell of human body. You can see inside the cell there is the nucleus. This is the mitochondria. This is endoplasmic reticulum on which the ribosomes are present. You can see the ribosomes are present. And you can see this is sodium potassium pump which is present on the cell membrane. This is a normal cell. It is getting the blood. Now imagine if this cell do not get the blood. That is, ischemia is happening to this cell. What will happen? Why the blood is required by all the cells? From head to toe, all the cells require blood. Why the blood is required? From the blood, the cell get oxygen. The oxygen goes inside the mitochondria, and in the mitochondria, the oxygen get converted into ATP. I mean, the ATP is synthesized in the mitochondria, and the mechanism is known as oxidative phosphorylation. In presence of oxygen, the ATP is synthesized in the mitochondria. That's why mitochondria is known as powerhouse of the cell. Now, if the cell is not getting the blood, the cell is not getting the oxygen, the cell is not getting the oxygen inside the mitochondria, there is no oxidative phosphorylation. If there is no oxidative phosphorylation, there is no ATP synthesis. So that is the mechanism ATP depletion. You will be thinking, ma'am, why ATP is required for the cell? For the cell, if ATP is not there, will the cell injured? Yes, the cell will have cell injury if ATP is not there by 3 mechanisms. So let me explain you the 3 mechanisms. What will happen because of ATP depletion? So first you have to draw this flowchart, and after that you have to combine 3 flowcharts here because of ATP depletion. What is happening? So the first thing which is happening due to ATP depletion. Now here there is ischemia. I told you the cell is not getting the oxygen, the cell is not getting the blood, so ATP is not synthesized in the mitochondria. This ATP, normally the ATP is required for the functionality of sodium potassium pump. For the functionality of sodium potassium pump, ATP is required. Now if there is no ATP, this pump is not functioning. Got it? This sodium potassium pump is not functioning. Normally sodium goes out and potassium comes in when ATP is present. This is happening normally. You can see the zoom version of this pump here. You can see this is the cell membrane. You can see sodium is going out. Look at the arrow. And you can see the potassium is coming in. Look at the arrow. This is normal. But imagine if ATP is absent, this will not happen. This is not happen because the pump is not functioning now in absence of ATP. Because there is ATP depletion, there is ischemia. Ischemia means no blood. No blood means no oxygen. No oxygen means no oxidative phosphorylation. No oxidative phosphorylation, no ATP. ATP is not there. The pump is not functioning. So sodium will not go out. Sodium will remain inside the cell. And potassium will not come in. Potassium will present outside the cell. So there is influx of sodium and efflux of potassium. The sodium is present inside the cell only, and potassium is present outside the cell. They cannot go inside and outside, like the pump is not functioning. And you know, water follows sodium. There is a rule. Wherever the sodium will go, the water will go there. So I'm saying the sodium is not going out. So water is also not going out. Normally sodium and water goes out, but here they will remain inside the cell and they will swell the cell. Now because sodium and water is not going, they will swell the cell. The cell will swell. Inside the cell, endoplasmic reticulum will also swell. Endoplasmic reticulum will also swell. The cell will swell. The endoplasmic reticulum will swell, and on the surface of the cell, small blabs will come. You know, these are the blabs I am drawing. On the surface of the cell, the blabs will come. So this is how the cell get injured. This is the first mechanism due to ATP depletion. The sodium potassium pump is not functioning. The second thing, again, there is ischemia, no blood, no oxygen, no ATP synthesis in the mitochondria. Now, cell will try to synthesize ATP without oxygen. That is anaerobic glycolysis. Anaerobic glycolysis. You know, in aerobic glycolysis, ATP is synthesized in the mitochondria in presence of oxygen. So it is a better way. More ATPs are synthesized. But if oxygen is absent, cell will try to compensate and try to make ATP